Hi, I'm Dr. Elizabeth Bauer, and welcome to Pharmacology for Veterinary Technicians. In the first class period, I'll be talking about how this class works. This is the first video of a series that will cover my lectures. The book that we're going to use for this class is Clinical Pharmacology and Therapeutics for the Veterinary Technician by Robert Bill. He's also called Pete Bill. He has recently retired, but before he did, he published this fourth edition. If by some chance you got a previous edition of the book, please take it back to the bookstore and get the most recent edition, published in 2017. The previous one was published, I think, in 2006. It's too old. You don't want to use that one. The new one is a lot better anyway. The reason I use this book is I really think this book respects your intelligence. I think that some of the other books that I've looked at out there that teach pharmacology do not go into sufficient detail. I think it's important that you know how drugs act on a more anatomical and physiological level, and I think this book really does a good job with that. You should be enrolled in the second Anatomy and Physiology class, BET 206, or have taken that class before. If you've taken it before, you might need to pull out those notes every once in a while and do some review as we're covering different body systems and drugs that affect them. But we try to have you go through a section in anatomy and physiology, and then I cover the drugs that affect it afterwards. So that is our intention. Dr. Lombard and I try to coordinate on this. So it's really important that you have had that course or you are having it right now. So the first chapter you can read, so I'm not going to read through this list, but when you encounter a chapter, um, at the start of it, it helps to go through the different topics. I think that will help you to understand what we're going to be covering. It does take a while to get into the terminology and vocabulary of pharmacology, but if you at least start looking at the topics and what's going to be covered in the chapter, I think that helps as we go through. This very first chapter, we're just going to be defining some terms and talking about drugs in general and information and dosage forms and that kind of thing. So first we need to define what pharmacology is. It is the study of how drugs work in the body, and we're going to be talking about that on an anatomical and physiological level. And then when we talk about applying drugs to specific cases and using them as treatments, that is what clinical pharmacology or therapeutics are. You might be hearing a little whining in the background from time to time. My little dog likes to be near me and he likes to kind of pull me away to where he wants to go, and that's what he's trying to do right now. But anyway, I'm going to continue through because he'll settle down here in a minute. So why is it important that you know about pharmacology? Can't you just fill prescriptions and hand them out to the clients, call them up, ask how the animal is doing, the next day? It's really important because you are the eyes and ears of the clinic. You're going to be going in and doing treatments and checking in on patients that are hospitalized. You're going to be handing the drugs to the clients and telling them what to watch for. You're going to be doing callbacks, and it's important to know if what a client might be telling you is an important thing to report to the veterinarian or if it's something normal that is associated with the drug. Sometimes we're telling clients to stop a drug right away if we're noticing a particular adverse reaction. And sometimes we want them to not stop it immediately. There's important reasons sometimes for keeping an animal on a drug for a while more and tapering them off rather than just discontinuing suddenly. All of these things you can't do unless you know what's important about drugs. The other thing is, this is what keeps you interested in the profession. This is what keeps you here, is understanding the why and the really interesting things behind why we do what we do. And I would believe that if you're hanging with this program, that's what's in part keeping you here, is the interesting parts about the why. So as we administer drugs, it's really important we keep in mind these 4 rules. They guide the safe drug usage that we are trying to achieve in practice. And so the first rule is that all drugs are poisons. Um, Obviously, we do not give out drugs that are going to do more harm than good, but it is possible if we administer them in the incorrect way. So, for instance, some drugs need to be administered um, via IV rather than orally because they do less harm that way. Some drugs cannot be given to certain species at all. They can be given to dogs, let's say, but not to cats at all. And then we need to administer things in the correct amounts. And so all drugs have the potential to be poisons. They can cause serious adverse reactions, they can cause death. So it's always important to remember that and not get just complacent in just handing drugs out. The second rule is that no drug is a silver bullet. An ideal drug would go right to the site of where we want it to act in the way that we want it to act, and act nowhere else. Just have a smooth administration and a smooth clearance from the body, have the effect we want, and it would be great. But most drugs do not do that. You will find lists of adverse reactions to watch for with just about every drug. So um, we always have to watch that. And it's a bit of a balancing act between providing the right treatment, but not having the adverse reaction. The third thing is that all doses are guesses. Initially, drugs went through trials. They tried different amounts per weight of animal. That's called a dosage. And an individual calculated amount from that dosage is a dose. And so when we give the dose, we are guessing. We're guessing what's going to work well in that animal. It may be based on their age or the condition of their liver or kidneys, which has great effect on how drugs act in our bodies. And we are always needing to monitor our patients and make sure that the animal is tolerating a dose really well. And the last rule is that complacency kills. So that sounds pretty harsh, but it's important. If you are following the first 3 things, then you won't be complacent. You'll be looking for whether the animal is tolerating a drug well, whether it's seeming to treat the animal properly. You'll be listening to the clients telling you what they're noticing about it, and you won't be complacent. We can get complacent by, giving out a million doses of amoxicillin, but it might be that next patient in which they just do not tolerate that drug very well. So usually when an owner is saying, when you do a callback and or if they call you and say their animal is vomiting or having diarrhea, one of your first questions ought to be, is your animal on any drugs? If you don't have the record right at hand, ask them, are we treating, Fluffy with something? Because that is a very good first guess as to why the animal might be throwing up or having diarrhea. So the way that drugs work is that we are wanting them to have an effect on the physiology, the normal physiology of the body, to have a beneficial effect that is going to treat what the condition is in the animal. We want to maximize that effect and decrease any bad physiologic reactions. So it's always a balancing act. And sometimes we're going to back off a particular dosage for an animal if that is causing more harm than good. But that's basically what we're trying to do with almost every drug, is get the beneficial effect for the animal, for their particular condition, while minimizing the bad effects that happen to the animal.